Okay, this one looks bigger than the other one. We're wrapped around the freaking bell here. Alright, scoop that baby up. That's a nice one. Bring it up over here so we can get it on the camera. And it's on, you got that sucker in there. One nice big bear trout. Alright. Okay, we are back at it. Had to take a quick break to go and reel in a nice big fat trout that we're gonna take home. And probably we've been making recently some spicy panko fried and then California roll with the sushi rice and some vegetables and avocados and spicy sauce. Whew, outstanding. So I think we're gonna have trout California rolls this evening. So anywho, back at it. So we laid the foundation, checked the other ones. So we talked about shunts and then Eisenmenger syndrome, and now we're back at it with particular shunts in the cardiovascular system, particularly the heart, that can happen when you're born or congenitally. Okay, so we're just going to run through 5 of them. Ventricular septal defect, VSD. Atrial septal defect, ASD. Patent foramen ovale, PFO, patent ductus arteriosus, and then a combo of 4 things, tetralogy of Fallot. All right, so we already mentioned a VSD, or a ventricular septal defect, in the last little bit. We were talking about Eisenmenger syndrome, but these ones here in red, boom, ventricular septal defect, atrial septal defect, patent foramen ovale, which is similar to an atrial septal defect, not exactly the same, we'll see, okay, and patent ductus arteriosus up here between the pulmonary circulation and the aorta, okay, and these 4 are initially going to be left to right shunts, okay. Now we will see that the patent foramen ovale doesn't really allow for much of a shunt anyway, okay, but they are not going to initially anyway result in cyanosis until Eisenmenger syndrome develops, and you can check that out in the previous vid. So anyway, with a VSD, what are you going to have at first? You're going to have a right to left shunt, okay. I have a younger sister with Down syndrome, which was born with a VSD. By the way, she is awesome, Shosh, and hopefully she checks this video out. She watches all the videos. Anyway, so, and she was born with a ventricular septal defect. I vaguely remember it. I was young. I didn't really know what the heck that was, but I do remember she had heart problems, and we really had to try to get her strong enough to do the surgery, but wanted to do the surgery as soon as possible, because now I know we want to avoid too much pressure going into the lungs, causing Eisenmenger syndrome and a reversal of the shunt. Luckily, that did not happen. And ooh, just saw a nice fish jump way out there. Hopefully we get another bite. So anyway, that did not happen. It was patched up, boom, and she still has it to this day. Now, anyway, so that's a ventricular septal defect. Initially right to left shunt. Could then result in a left to right shunt over time with Eisenmenger syndrome, and then potentially some cyanosis. The key point there with the ventricular septal defect is this blood from the left ventricle has a lot of pressure. So that makes it likely that Eisenmenger syndrome with the narrowing of the pulmonary vessels will happen if it's not corrected, okay? And then that left to right could convert to a left to right shunt. Okay, so that's a ventricular septal defect. How is that going to look in our little person down here? Well, initially with a left to right shunt, that little person is going to not be cyanotic at all, anywhere. Yes, why not? Because it's a left to right shunt. We're sending oxygenated blood back to the lungs, not deoxygenated blood out to the body. However, if we allow this to go on too long, okay, then that left to right shunt gonna turn around to a right to left shunt, and cyanosis everywhere will develop. Okay, so that is a VSD. Okay, so we'll clear out our little person here and we will get back to work. So, atrial septal defect. Okay. So first of all, let's differentiate between an atrial septal defect and a patent foramen ovale, PFO, okay? An atrial septal defect is just what it sounds like. The septum doesn't form right between the atria, and there's a hole there, and it's always there, okay? So then you're going to have, generally speaking, a what? Left to right shunt, sending some oxygenated blood to the left, from the left atria to the right atria, and eventually back to the lungs, okay? So again, how is that person going to look? That person is not going to have cyanosis generally. Why not? Because it's a left to right shunt. And actually, this chamber, the left atrium, does not have so much pressure. So we are not adding that much pressure to the right side. So it would take a long time for Eisenmenger syndrome to develop. So it's not efficient to do it this way, but it will not necessarily result in a switch to a right to left shunt and cyanosis. So we're just going to say that this person stays pink, okay? Even though blood is being sent. What is the key difference between the ASD and the VSD? The amount of pressure coming from the left ventricle over here is a lot. From the left atrium over here is not a lot. Okay, and so Eisenmenger syndrome less likely to develop with an ASD. Okay, so what is a patent foramen ovale? Okay, all of us have a foramen ovale, an oval hole between the right atrium and left atrium when we are inside mom. That is a normal fetal shunt. Yes, go check that thing out on why circulation is different inside mom. Okay, so really it's kind of a flap like this that only opens when it's pushed from the right side to the left, not from the left side to the right. Okay, so that in mom allows blood to go this way, okay, but not the other way. Okay, now when you're born and you start breathing and these things open up going to the lungs, the pressure drops, boom, in the right side, and so this thing is going to just be held closed, right, by the pressures on the left side versus the right side after we are born. Okay, now most people actually, this thing will fuse close, but there are a decent number of people where that doesn't happen. So it is not open all the time like an ASD is, okay? It's a flap that only closes this direction, and because the pressure is higher this side than that side, it's held shut. Most people it fuses shut so it can't open, but some people it is possible for it to open. The only time that opens is if there is a transient increase in the pressure on the right side over the left side, like coughing or something like that. Now what that could do is briefly boop, push this thing open, and a little spurt of blood boop, could go over there. Now that's not that big of a deal. And in fact, this person with the patent foramen ovale is also going to be pink, okay? Right? Because that's a small amount of blood. Now the only thing that could happen that could be problematic is if we had a clot, that, let's say an embolus, that came from the inferior vena cava from, let's say, one of our legs and traveled on up in here into the right atrium. Usually that's the only place that can go is boop, 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 out here to the lungs for a pulmonary embolism. But it's possible that this thing, if we have a patent foramen ovale and it happens to be opened at that time, it could boop, go over there, and this clot that came in from the inferior vena cava could make its way out into the aorta and maybe go up into the brain and give a stroke or something on the systemic side. Okay, this is called paradoxical embolization, okay, because it is paradoxical for an embolus coming from the systemic circulation to not go and get stuck in the lungs, but to make it out here to the systemic circulation and get stuck in the brain or some other place. Okay, so that is a patent foramen ovale. Okay, all right, now clean that up. So a patent ductus arteriosus. What is the ductus arteriosus? The ductus arteriosus is a connection between the pulmonary trunk and the aorta, which again exists in all of us when we are inside mom. This is a normal fetal shunt. Check that video. Now, most of us, once we start breathing oxygen and pop out of mom, this thing closes. Okay, okay. And actually it will fuse and form something called the ligamentum arteriosum. Okay, so that connection is no longer there. Okay, so because this would be a shunt connecting the left sides and right sides without going through the lungs or the systemic circuit. Okay, but let's just say that does not close. Okay, now once again, what direction is this shunt going to initially be going? Initially, it's going to be going like so. Yes, from the left side to the right side. Why? Because the pressure in the aorta is higher than the pressure in the pulmonary trunk. But once again, so anyway, initially with the patent ductus arteriosus, how is our person going to look? They are going to be pink all over. Yes. But we are sending now pressurized blood into the lungs. So what's going to happen? Eisenmenger syndrome eventually. What difference is that going to make? That is going to make it so that eventually that right to left shunt is going to become a... So did I say left to right shunt? The left to right shunt is going to become a right to left shunt. Yes, because of Eisenmenger syndrome, okay? At some point, it's easier for the blood to go this way than to go into those lungs with the narrow vessels. Okay, so now this is kind of interesting. So now, we got to remember some anatomy. Where do these three vessels go? Coming off the arch of the aorta, they go up to the head and upper extremities. Yes, okay. Where does this go? This goes down to everything else. So this blood up to this point is going to be fully oxygenated blood. So the top half of this person is going to remain pink. However, very interestingly, we are going to develop something called differential cyanosis. Ooh, what the heck? The top is going to be pink because this oxygenated blood from here is going to the top of the body, okay? But this deoxygenated blood is meeting up. The key point is the ductus arteriosus occurs after, boom, 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 the three arch vessels. So now from here on down is going to be blue blood. So we're going to have pink on the top and blue on the bottom. Pretty wild. Yes, okay, so that is a patent ductus arteriosus. It was initially a left to right shunt, so everything was pink. But if Eisenmenger syndrome happens and it reverses, whoop, then we have a right to left shunt, but not everywhere in this, just after the vessels going to the top half of the body. So the top half stays pink, the bottom half is blue. Very interesting. Okay, now tetralogy of Fallot. Okay, so this is 4 congenital malformations. All right, so let's do this. Okay, so let me clean this up just a touch and we will knock this out. So now, what do we have in tetralogy of Fallot? We have 4 problems. 1, we have narrowing of the pulmonary trunk. Yes? So narrowing of the pulmonary trunk heading to the lungs. All right. We have a ventricular septal defect. Okay. We also have an overriding aorta. What does it mean? The aorta is not so much just over the left ventricle, it's over both ventricles. Okay, and lastly, we are going to get hypertrophy, big muscle in the right ventricle so that the heart actually looks kind of like a boot. Yeah, okay. With the heel of the boot being all this extra muscle right here. All right, sweet. Now, What does all that mean? Well, here's the deal. We're still trying to pump this blood through the lungs, through this narrow, high resistance pathway. So we're squeezing really hard. The right ventricle is getting stronger and stronger and stronger. We have this shunt here, which could initially be a left to right shunt, but because of this narrowing and this thing getting strong, the pressures here are going to be higher than they are here, maybe even inside mom, yeah, okay. And then we are going to start out with not a left to right shunt, but might be born with a what? Right to left shunt. Yes, okay. Why? Because of this narrowing of the pulmonary trunk in addition to the shunt. Yes, so this poor little baby may be born with cyanosis. The main thing determining how much cyanosis may be there is how narrow is the pulmonary trunk. Yes, how stenosed is that thing, right? If it's super narrow, the blood's gonna go this way. If it's not so narrow, maybe we'd have a left to right shunt. Anyway, so that is tetralogy of Fallot. 4 things. Some of the key ones though being a ventricular septal defect and narrowing of the pulmonary trunk exit, okay? That causes an increase in resistance, raises the pressure, gives you hypertrophy, and then the right ventricle is stronger than the left, and boom, there it goes, right to left shunt, and we have deoxygenated blood going out. We're coming from the left ventricle into the aorta, so that's going to go whoop to all the things going to the upper extremities and to the lower half of the body, so the entire body would have cyanosis. All right, I hope that was helpful to you. We knocked out a bunch of things that can go wrong with the heart with shunts, and hopefully that helped. One last look around. I don't see any getting any bites yet. Maybe we'll get one more bite, or maybe we'll just go home and eat that boy and have some California rolls. Take care and God bless. So here we are with the spicy trout fried California rolls. Yeah, pretty good. Wanna try one, Natanya? Let's see if they're any good. You wanna try? Do you want soy sauce? No? Yeah, what do we think? Yeah? I'll try one.
I'm good at making this, but not tasting.
Thumbs up. Lots of fun.
I'm good at making those, but not tasting them.
You like it, Tanya? Yeah?
Yeah.
Yummy? Alright.
Thanks for watching Physiology Fundamentals with Dr. H. Please like and subscribe, and don't forget to get outside and go for a run.